Hey everyone, what's up? This is Dr. Charlie, physical therapist. In this video, I want to settle an age-old debate about if you have back, butt, or sciatica problems, should you see a physical therapist or a chiropractor? Even people within the profession of physical therapy and chiropractic argue about who's better and who's best suited to solve these problems. And so it doesn't make a whole lot of sense. It's actually fairly straightforward, the answer, and I want to put it in a way that makes sense to you and helps you make the most informed decision about who you want to see. Because at the end of the day, what is chiropractic and what is physical therapy? Well, they're just different ways of moving your body and or teaching you how to move your own body. So all rehab is motion. This is the first thing you need to understand, all right? So whether you go to see a chiropractor or whether you go to see a physical therapist, they're just moving your body and or they're teaching you ways that you can move your own body. So you can go to someone and they can move you and or you can learn to move yourself. And so in this video, rather than creating some type of further rivalry between physical therapists and chiropractors, I just want to help you simplify this idea of who should you see and why should you see them. And hopefully at the end of the day, you can make a more informed decision about who is best suited to help you out. Real quick before we dive into the video, if you are wondering what the cause of your back, butt, or sciatica problem could be sure to check out my DIY diagnostic guide. You can download it by clicking link above or I think it's somewhere in the description. I outline all my exact diagnostic algorithms and thought process for figuring out the most likely source of your symptoms. So just to be clear, both physical therapists and chiropractors can do different hands-on treatments to move you or move your body in different ways, and or they can teach you how to move yourself. So what's the difference? Well, the truth is that if you find a really good chiropractor and or you find a really good PT and you pair them up, there really isn't that much of a difference. Now, that being said, I am a physical therapist. That being said, why do I feel like I can talk about this? Well, I used to teach hands-on courses. I was trained by osteopaths as well as chiropractors in different hands-on techniques, despite the fact that I'm a physical therapist by license. So I used to live in a world where I would be doing different treatments to move you. Meaning you would go to old Charlie and I would crack your neck or crack your back or try to move your pelvis in some way to reduce your pain. New Charlie no longer does that because, this is something maybe to think about when answering the question of who should you see, because I moved from a place of fixing people to teaching people how to fix themselves. So that brings me to my first point in making a decision about who you should see, a chiro or PT. At the end of the day, regardless of who they are, let's just get rid of the label, someone who's trying to help you and can either teach you to move yourself or move you. At the end of the day, you want to ask yourself, what gives you the most control? Does somebody who's trying to fix you and resolve your pain, do they put you in a position of control and or empowerment more so than the person who is trying to fix or teach you how to fix yourself? Now, it's really up to personal choice here, but I moved from trying to fix people to teaching people how to fix themselves because what I found is that I was really good at fixing people for an hour, a day, a week, something like that. But the people in pain, people like you, were terrible at fixing themselves. So I said, hey, what if I could give you my brain? Would you feel more or less confident in solving this problem? And if you're watching this and you hurt, you're probably saying, well, that would be cool. Charlie, if you get hurt, you probably know how to fix yourself, right? Well, yeah, in most cases, right? And so what if you had my brain? Would you feel more or less confident in solving the problem? And if the answer is, I think I would feel much more confident, then you can see the power in having someone teach you how to move yourself in a way that resolves your pain problem. Now, that being said, if we were cars instead of human beings, then it makes sense maybe to just pay someone to fix it or fix you, right? And think of it like this. If your car breaks down, it's really easy. You just go, you drop off the car, they tell you what it's going to cost, what they have to do. You get a loaner, you can go on with your life while that car is being fixed. But because we're humans and not cars, we can't do that. We can't drop our bodies and brains off at the chiropractors or at the PTs or at the surgeon's office, have them fixed, and then at the same time be productive and go about living our lives. So at the end of the day, because we are ultimately the ones in control of our brain and our bodies, it probably suits people in pain to learn how to solve their own problems. Essentially, finding someone like myself or someone else out there that you can trust who feels confident in teaching you what they know so that you can be in a position of control and learn to move yourself. So that's the first thing. Ask yourself, Do you want to be reliant upon other people to move or fix you, or do you want to learn how to fix yourself? And really in answering that question, you're answering this concept or idea of, do I prefer to have more or less control? And when you decide what you want to do to solve your back, butt, or sciatica problems, you have to look at it through that lens. Is going to the acupuncturist, is going to the chiropractor, is going to the physical therapist, for the sake of this video, PT versus chiro, right? Who's going to give me the most control? Either of them could, but it depends. Are they more based in education and teaching how to fix yourself, or do they just lay you down, crack your back, and then send you on your way? They don't change the knowledge that you have in your brain. You continue to have the same problem come back because you don't know what you need to do on your own to solve your problem. So if you rely upon someone to move you, then you have less control. If you learn to move yourself, then you have more control. It's as simple as that. Now, this brings me to my second point. Because we both agree that chiropractors and PTs are just people who want to help you and can try to fix you with hands-on treatment and or teach you how to fix yourself, and therefore they're not really different, they're just labeled differently. And a good chiro and a good PT look probably almost identical in the way that they assist people. Then the second point that I want to bring up is this idea of like, not only which gives you more control, that's the first point, but the second point is what gives you the greatest opportunity for relief, which gives you the best chance of solving your issue. Going to someone and having them fix you, crack your back a few times a week or give you stretches or whatever a few times a week, or learning to treat yourself. So to answer this question, let's go back to basic logic and let's do some simple math. So let's just say that you go to a physical therapist and or a chiro for 3 times a week for 6 weeks. So maybe you've gotten a script to go to physical therapy, or the general practitioner will often just write you a ticket to get in the door and say 3 times a week for 4 to 6 weeks. So let's just say 3 times a week for 6 weeks. And when you go to that appointment, you get your back cracked or your neck cracked, or you do a couple different stretches. But let's just define that as one treatment. All right, so you're getting 3 treatments, and you're doing it every week for 6 weeks. So 3 times 6, last time I checked, was 18, right? So you're getting 18 treatments over a 6-week period. Or think of it like this, 18 opportunities, problem-solving opportunities to resolve your pain and really crack the code, or figure out what the problem is and find the answer. Now let's compare that and see what chance you would have of solving your problem if you learn to treat yourself. So to do that, let's go back here real quick. So you get 3 treatments, maybe 3 rounds of adjustments every week for 6 weeks. You get 18 opportunities to resolve your pain or figure out what's going on, and again, identify the solution. So now let's just imagine that instead of having to go to the office 3 times a week, this chiropractor or this PT who realizes that fixing you is limited in the ability to help you because, well, you kind of have to figure out how to fix yourself because, again, you're the only one in control of your brain. And your body says, you know what? Yeah, we're going to do these treatments, but what I want to teach you to do is not have to rely on me. So I'm going to teach you how to replicate this treatment that we've done in office. So this way, instead of just getting 18 different treatments, you can do it whenever you want. So now let's just assume that they were very scientific in their approach and they found one thing that was most valuable to you, one treatment that was most helpful, be it a stretch or an adjustment or something like that. So you have one move or motion, if you will. We're going to say motion or exercise, if you will, because remember, they agreed that, hey, we can fix you temporarily, but in order to see long-lasting results, we want to teach you how to fix yourself. So you do one motion, or you've identified one motion that they did to you, but now they've translated into a way that you can do it yourself. They made it an exercise that you can do at home, so this way you don't need to rely on them. And instead of having to drive somewhere to do this motion, well, because you control your body, you can do this motion or this exercise as much as you want. So then you take that motion and you put it inside of this bottle. You bottle it up. That's supposed to be a pill bottle, all right? And on the label, there's some prescription. There's a dose, how much you do it. There's a frequency, how often you do it. Here it was 3 times a week, right, for 6 weeks. And then there's a timing. When do you do the treatment, all right? So what you decide to do is get super smart, or they're super smart, and they take this adjustment, this treatment, they put it into an exercise, they bottle it up for you, and they send you home, and they tell you to do that. Hey, one motion, you're going to do it 5 times throughout the day, and then you're going to do it for a given amount of time. So assuming that you were able to translate what they were doing 3 times a week into one motion that gave you the same positive effect, and now you're doing it 5 times a day, well then let's do the math on that. So, calculator, 5 times a day times 7 days a week, 35, times 6 weeks. 200, hopefully you can see that, 210. Now what does 210 mean? 210 opportunities and or treatments that you can apply just by learning how to move yourself versus having to rely on other people to fix you or to treat you. So you could go to a PT or you could go to a chiro and you could give them the control, or you could gain control back by learning and gaining the knowledge, tools, and understanding you need to solve your problem. Up to you. How much control do you want? Then pick. And what this would mean is don't pick per se PT or chiro. Pick someone who values education and is willing to give you what they know so you feel more confident resolving your problem. It's the first thing you need to consider and or ask yourself when trying to figure out who's going to be the best fit to solve your problem. The next thing you want to do is ask yourself, what or who gives me the best opportunity for solving this issue? Maybe you start off and you go to a PT once or twice or 3 times, and if they're very scientific, they recognize that instead of you having to go there all the time, they can teach you what they know, they can identify the 1 or 2 things that are most valuable for you, they can bottle that thing up into an exercise or a motion that you can do that gives you the same positive benefit without you having to go to their office. And then you can do that as much or as little as needed. And you have ultimate control because then you can test very rapidly. Instead of getting 18 possibilities or 18 treatments in a 6-week time frame, you have the potential to get up to 210. Or if you want to do it 6 times, well then you increase that even more. If you want to do it 10 times a day because you find that that frequency works best for you, then you, knowing what you feel as someone in pain inside your body, can start to play around with optimizing this movement prescription to find what's going to work best for you. And so you're going to pick up and collect data a lot faster if you learn to move yourself versus relying on someone else to fix you. So those are my thoughts. Notice how we started with this whole discussion, right? You came into this video thinking, well, I want to know, should I see a PT or a chiro? Then I kind of broke that belief and or that thought process down and said, recognize that they're both doing the same things. At the end of the day, they're both people who want to help you and have spent a lot of time, energy, and money trying to do that, right? And they can either do hands-on treatment to fix you or move you, and or you can learn to move yourself. So all rehab is motion, and it's your choice at the end of the day. There's essentially no difference other than the label that you've applied to them, right? Then ask yourself, who do you feel can give you the most control? Who meaning just the individual provider, the person that you're seeing, and who gives you the most opportunity, or how can I create the most opportunity to solve my problem? And do you think it's by going and relying upon someone else to fix you, or do you think that you could gather data and get better inputs by learning to move yourself? So the answer is clear to me. I prefer to teach people how to move themselves, but obviously at the end of the day, you watching this are going to have to make the most informed decision about what to do for your own situation. That being said, let me know your thoughts in the comment. Which do you prefer, or which do you choose? Because you're going to have to make a choice at the end of the day. Was this helpful? Was it not? Let me know your thoughts. Hit the like button. Also, hit the bell after you've subscribed for notifications when we go live every single week.